Great. Thank you, Helen. It took me a little moment there with the technology piece. It's not my area of skill whatsoever. But thank you very much, Helen, and the Irish Heart Foundation for the opportunity to speak to the patients, families, carers today. And I suppose exactly what you touched upon around that accessibility piece. So I want to really help people understand how best their pharmacist can help them and how to get the best out of the pharmacist and really empower people that if they're not getting the service or they're not confident in asking for the service that they need and deserve, how to go about that. Um, so you've absolutely covered it off. I've been a pharmacist for more than 25 years and I've done extra diplomas in other areas as well. And that lifestyle medicine, positive health is where we have to try and really encourage people to take ownership and be involved in their own decisions around healthcare. I don't think it's sufficient anymore for a prescriber, whether it's a consultant or a GP, to just simply prescribe something without explaining to people what are the benefits, what are the risks, what happens if we don't take it, what to expect if you do take it, and then that people can be involved in with every decision regarding their healthcare. So pharmacists are community-based healthcare practitioners. We are clinically trained. Most pharmacists will have done at least 3 to 4 years. Mine was a bachelor degree. All pharmacists now come out with a higher qualification of a master's degree and then an extra year in practice learning before. So it's 5 years before they're qualified. And they have a really high level of clinical skill. So with that, you have access, walk-in access to a healthcare professional. And I'd advise anyone there to make sure that they use that. Most times we don't need an appointment for your pharmacist. We tend to be open longer hours, maybe 50% more hours than a GP surgery. So my pharmacy would be open till 7 every evening. We open Saturdays. Many pharmacies open till much later, even Sundays. So that flexibility is there. And the flexibility in terms of the contact that the pharmacist will have for you, walk-in, phone, other means. And what we, as a profession, we don't want people to be sitting at home with healthcare queries to think, God, I was only in yesterday. I can't ring them. They'll think I'm a nuisance. They'll think I didn't listen. That's what we're there for. So any question that we've ever heard or anything that you think you might want to ask, we have heard before and we will contact you and be in contact in whatever way people need. Sometimes if people are maybe homebound or mobility is an issue, phoning the pharmacy, we have lots of people, and I have to say the older generation, fantastic. I find that embracing technology. And I have lots of people that communicate to our pharmacy through an app or through email or whatever way works. So whatever way they can communicate best, contact your pharmacy and see what works. It's a very informal setting. So, and that is really important for people because we know when you are stressed and anxious about your health condition or about someone that you love and care for and you're minding, um, when you go into a secondary care, so hospital or clinic, that actually you can begin to get a little bit stressed while you're waiting on the appointment. The appointment might be late. So it's very, very local. It's very non-threatening. It's very, very easy to access. It's relaxed and approachable. And because we have that straddling private and public system, we would treat all people absolutely equally. It makes no difference in your ability to pay the level of service that you get. And it's really important that people know that. Every pharmacy by law must have a consultation room, and that is a room that is visually and audibly private. So once you access that consultation room with the pharmacist, nothing can be heard and nothing can be seen in the rest of the pharmacy. And that is in law. So it's really, really important. That's giving people reassurance that whatever question and query you have, that you can have that conversation in a private manner. People sometimes would say to me, "Oh, I don't like to disturb you," or "Do you have time to speak to me in there?" Absolutely. That's what our role is. And whilst we dispense medicine, the majority of our role is around counselling for people, telling you what to expect from medicines, talking about queries and issues you may have. And we'll cover off some of those now, but also to make sure and give people reassurance that actually, let's look after yourself. Let's give you the best chance at the best quality of life, regardless of any condition. So just with that, what does your pharmacist do? So I'm going to talk through in a few moments about your prescription journey, what happens when we get a prescription. But just that first point of contact when it comes down now that between the public and the medical world. And if something has happened, like cardiovascular events such as stroke, and if there's been no history and it's come out of the blue, you're thrown into a lot of jargon, you're thrown into a health system that you may not have any really kind of workings with. And it's very hard to begin then to get what does this mean? What does GMS mean? What does LTI mean? What does a drug payment scheme mean? What does this blood pressure reading mean? What does this blood level mean? So we try, it's very difficult to get all of that. And we would encourage both patients, survivors, and their family to come in and we can talk them through all of the jargon, what it means to them. And we would have a direct role in referring red flag symptoms. So obviously with stroke patients, we would be very active in making sure that patients and families know what red flag symptoms to watch out for should be a stroke coming on, what to do, and then 999. And within our pharmacy, we have a cardiac first responder as well. So we would be very active in going into the community if anyone has a concern. With that, it's a very critical gatekeeper role. So we're not simply just providing medicines and we see you in 30 days when you come back in to collect the next batch of medicines. We're there. The continuity of care that we provide to patients is really important. The patients know that. And we're at the end of the phone. And then once there's been an event such as a stroke, we work really hard to make sure the patients understand their condition and their treatments. And with the condition and the treatment, what medicine is going to work for what part of their overall treatment and what to expect in terms of benefits, in terms of side effects, what to manage side effects. Some side effects can be really easily managed with simple changes, such as when we take a medicine, or maybe the formulation we give it to you in, or maybe something needs to be switched altogether. And then we are the link between all of the healthcare practitioners. So if someone's been in hospital and they're discharged, they typically bring the prescription to the pharmacy. We fill that prescription. We then communicate that to the GP. Waiting on the paper trail that often follows between a hospital setting and a GP setting, it can take quite a bit of time and it's not always accurate. If a patient ends up in hospital with an emergency event, 9 times out of 10, the nurse, the pharmacist, or a doctor attending to that patient will ring your local pharmacy to see what other medicine that patient takes. And we go through, we have the real-time most accurate picture of a medicine, of a patient medication history. Because if someone is going to perhaps a cardiologist, they're going to the GP, they might be going to an endocrinologist for diabetes, might be going to a respiratory doctor for their breathing difficulties. They don't always talk together in a real-time fashion. So we always encourage people to have their medicines dispensed in the one pharmacy where possible, because we have the full picture of everything that's going on. And we are very often the link between all the healthcare professionals. They'll link in with the pharmacy and we can share that information. It's important that people realise that Ireland is really forward in some aspects, but in terms of IT and computer systems in our health service, we're really not very advanced. So my computer system isn't linked up to any other pharmacy computer system, nor to the GP. And the GP computer system isn't linked up to the hospital. So eventually the country will get to a point where we have, if you can imagine your driving license, a little plastic card that would have your unique identifier, and you could show that card, and that would have a particular barcode, and a hospital or a paramedic or a GP or a pharmacist, and we would be able to access pieces of information, and then that would give everyone helping a patient a much clearer view. So that's where we're trying to get towards, but we're not there yet. So by encouraging people to use the same pharmacy, it means that there's one place that has all of your history. And then with that, we try and help patients and families navigate the various state drug schemes. And it's really, really hard to get your head around, what am I allowed on a particular scheme? Does another scheme apply to me? Am I eligible for a medical card? If I'm not eligible for a medical card, am I eligible for the drug payment scheme? What cost implication is there? What other things can I do? If it's an unlicensed medicine, it mightn't be allowed on any schemes. And then we talk about medicine shortages, and that has really given people huge amount of distress and worry over the past kind of 24 months, and we anticipate that may worsen and increase. So we work in that kind of reassurance to try and make sure that people understand we're trying to get the most appropriate medicine, the safest medicine, at the right treatment, at the right dose, and make sure the patients understand that it's what it's for. If there's a difficulty with your medicine, we're working to try and make sure that we substitute it where possible. So with your prescription journey, so say possibly someone has had a stroke and they're being discharged from hospital after a number of days or weeks or from step down care or whatever has happened. The prescription will come into the pharmacy from the patient's family will bring it in usually, or the patient may come in. And there might be anything from 3 or 4 items on that prescription to maybe 12 or 14 different items. And there could be as many as no problems to 7 or 8 different problems on that prescription. And we would, pharmacist first and foremost goes through everything to make sure that the prescription is written in a legible format, that the doses are accurate, that they're correct, that they're licensed, that they're appropriate for the condition that has happened or what's going on. And then we begin to work through if there are any issues, we contact the prescribers, so the hospital, any issues that need done. If something's not in supply, if something's not available, we work to get an alternative recommended. And eventually then we then dispense that prescription. From there, we go out and speak to the patient or their family member and see what can we do in terms of eligibility. And that means how can we get those medicines to you in the most affordable way? And I think someone's going to speak to you perhaps later in the week around your entitlements as well. But how do we get that medicine to the most affordable way? So if you're not eligible for a medical card, which is dependent on family income or the household income, there is a long-term or there is a drug payment scheme, which means that the threshold for a family per month is €80. I was really hopeful that that would reduce in last week's budget. I really had hoped it would come down to 60, but unfortunately it didn't. I was really surprised it didn't. But a lot of the newer anticoagulants are very, very expensive, and just one of those, maybe plus a blood pressure medicine, would bring that up to €80 straight away. So we try and get people to get their medicines in the most affordable way. There is a long-term illness scheme, and some of you may have heard of that. And stroke, unfortunately, and cardiovascular disease doesn't fall under the long-term illness scheme. It's a really archaic, antique scheme almost that only has very specific illnesses, and the HSA are reluctant to add any other illnesses on. So I actually wouldn't expect the long-term illness scheme to be in operation for much longer. So with that, once we've dispensed that medicine, we may or may not decide, or may talk to the family and say, can the medicine go home in its original packaging, or perhaps do we need to give assistance around compliance age? And I'll talk through those a little bit later, whether it's a blister pack or whether it's something that can be filled at home by a family member, or whether the patient can do it themselves. So we talk around once everything's dispensed and accurate and we know it's safe and efficient, how are we going to make sure that the patient can take the medicine exactly as prescribed, exactly as needed, because it's not going to work if that doesn't happen. So our next stage is to make sure that that happens. And pharmacists are among the most trusted members of your care team. And just the top corner there, the veracity index will always show that pharmacists, nurses, and doctors, we would usually hit around 95 to 96% satisfaction rate. I was at a pharmacy conference over the weekend, and Minister Donnelly, the Minister for Health, was speaking at it, and he said any politician would love to have a satisfaction rating of more than 50%, never mind be a healthcare professional, with a satisfaction rating of 95 to 96. And then because of our unique position being in your community, so 85% of the population live within 5 kilometers of a pharmacy. That's in pharmacy in Ireland, we have no regulations to open. So in the UK, there has to be what's called population criteria. So there has to be a minimum number of people in a particular area before a pharmacy can open, or before a second pharmacy can open. And there must be a minimum amount of meters between pharmacies. But in Ireland, you'll very often see pharmacies side by side, buildings side by side, a couple of pharmacies in the one health centre. There are actually no barriers to opening pharmacy here. And that means that almost every town and village in the country has a pharmacist. So people have a really, really good access. We have the highest number of pharmacies per head of population than most EU countries. So that just means that actually the accessibility is really, really key. So even when we look at things like maybe COVID vaccination, we could see we were reaching areas of the country that maybe not have been reached before. So many people will see their pharmacists much more often than their clinic providers. So when you're seeing the GP, maybe only every 3 or 6 months, you might only see the consultant only every 12 months when things are settled and stable, but you will see your pharmacist at least every 28 days, 30 days, if not in between for other visits and conversations. In the UK, there was a new medicine service established, and we're trying to get something like this established in Ireland. And it was very successful in terms of anticoagulation. And the new medicine service works in a way that, as I described, the prescription would come into the pharmacy, we would dispense the prescription. I may not see that patient for another 28 days until they come and present for the next supply. And most people run into problems with medicines within the first 10 days or 2 weeks of their new medicine. And very often people will decide by the time they get home, they might read the leaflet, which has everything that the company needs legally put on a leaflet, but they might really leave it and say, I'm not taking that. Or they might speak to a friend or a confidant and say, oh, I had that and that made me very sick. Oh, well, then I'm not going to take it. Or they might take it for 4 or 5 days and think, I don't feel any benefit or I'm not feeling particularly great. And they might decide not to take it. Or they might be taking it exactly every day as they should, but they might not be taking it before food or after food or some maybe additional measures that need to be taken for medicines. And then that's not getting the best treatment for patients. So the new medicine service that works really well in the UK for a certain number of medicines will be we dispense it on the first day, and then the pharmacist will arrange a phone call or face-to-face conversation with the patient on day 10. And that's really good to identify any problems that the patient may have up to that point. And then they'll arrange another conversation within 7 to 10 days again and check in. So any problems that have been addressed. And then by that second conversation, if there are problems still being experienced, the patient will be referred back to the GP or the consultant, and then we can look at an alternative treatment if necessary. So it's been a really, really effective service, and we're hoping for something like that. It does happen in Ireland on a very ad hoc basis. It's not funded, so it just happens. Perhaps I know as most patients, I'll give you a ring in a week or two, let me know how you're getting on, and we'll iron out any problems. But that it doesn't happen in every pharmacy and it doesn't happen for every patient because it's not a standard service, but it's something that we would like to see happen in Ireland. So other ways in which we help with people, we support people to engage in healthier lifestyle choices and activities. And that's not just for younger people to go out and run 5K. That's even for people that are perhaps housebound or have significant mobility difficulties, that how can we help those people still live the best life that they can, still have a really good quality of life? What activities or lifestyle choices can we help those people make? People don't always think the pharmacists are there, but we're healthcare professionals. We're not just a supply function to give you medicines. We're there to help with all of the health and well-being of people. In terms of secondary prevention, so usually when someone has had a stroke, they come home, there's that rehabilitation stage that they need to work through, and then we start talking around, let's work together. What do we need to do to make sure that this doesn't happen again? And whether it's lifestyle and health choices, whether it's medication issues, making sure that people are able to comply and adhere to the medication regimen that is being prescribed. And we use simple conversations. So pharmacists are really, really skilled at conversations and at questions. And sometimes when you're in with your pharmacist, you might come away and think, well, that was a bit of a Spanish Inquisition, but you'll be surprised at the amount of information that we've gleaned. Or you might not realize that, and we've already discovered that perhaps something's causing constipation, perhaps somebody's having raised blood pressure, maybe there's a cholesterol issue, or maybe a family member has all of these and we need to talk to the family member about their own risk. So we work to make sure that there's early detection and treatment of all health problems, but particularly around cardiovascular issues. We know that there's a strong genetic link, and we try and make sure that other family members are aware on what measures can we put in place to help those um, prevent problems happening in the first place. To give you reassurance, the confidentiality is the utmost importance in pharmacy, and that would be one of the golden rules for all members of staff. I would, I have this week in the pharmacy, I would have transition year students in. And before we even show them where to hang the coat, I will have the confidentiality conversation. And it's down to they're not to go home. No one in the pharmacy is to go home and say, oh, I saw Mary Murphy in the pharmacy today. Because for someone at home, that'll be, who's she in for? Something not well. We know what human nature is like. So confidentiality is absolutely utmost. And to give people and their family members reassurance that whatever happens and what conversations happen in the pharmacy, they stay there. And then with consent, where appropriate, we speak to GPs or consultants if we need to. So very often if someone has a problem with their medicine, I'll say, is it okay if I give your GP a shout and say this isn't working for you and we're going to try and get something else sorted? And people are happy to go ahead with that. But there is no other way the confidentiality should be broken. So just to give you that reassurance that whatever you need to talk to the pharmacist about, they're approachable and ready to help. Additional services that we provide, and they will be appropriate for stroke survivors and their families. So not just the medicine and health advice and dispensing prescriptions and minor ailments. Minor ailments would be things that are minor and self-limiting in nature, such as coughs and colds. But that's really important that you access the pharmacist around that, particularly if person is a stroke survivor and there are other medications. Anything taken together has a significant risk of interaction. And it could be something that we call a drug-drug interaction. So one drug could enhance or block how another drug works, makes things can make side effects really significant, can cause really serious reactions, or there could be drug person reactions. So whether there's a drug or a drug food reaction. So any minor ailment, it's important that you go where possible to the same pharmacy because they would have that full picture of what you have or what you take from a prescription point of view. On that, anything you take, any other supplements, whether they're vitamins, complementary therapies, anything from a health food store, again, there's the potential for interaction. So it's really important that you clear all of that with your pharmacist. People will say to me, "Oh, I didn't want to tell you because I got it in the health food store because I didn't want you to think I was buying it somewhere else and not coming to you. Or I got that in the other pharmacy down the road and maybe I didn't want to tell you." That's no problem. Our ultimate concern is always the patient's treatment outcome and quality of life is the best, and the treatment is as good as it can be. And we can only do that with the full picture. We do provide cardiovascular screening, and most pharmacies will provide blood pressure measurements, um, both to patients who are maybe survivors of an incident or those that are just trying to keep on top of their health. We also provide 24-hour, that's the APBM, is 24-hour blood pressure monitoring. And it's the very same, these are the same equipment that GPs provide. And what that does, it means that people can come to the pharmacy, have these measurements done, and attend the GP with the measurements already done. And it kind of frees up a bit of time and gives people back ownership and control around their own health. Some pharmacies provide cholesterol testing, BMI measurement, and smoking cessation services. And this is all really key to try and both prevent events happening in the first place and also try and prevent a secondary event. In terms of vaccination service, and we're into winter vaccination campaign at the minute. We're in week 3 now at the minute, and we'd encourage everyone, where possible, particularly if they're the at-risk group, to avail of the flu vaccine and the COVID booster. So currently the HSE at-risk group, anyone over the age of 65 should avail of a free flu vaccine, and anyone over the age of 50 should look for their extra COVID booster. And we are giving both at the same time. The questions that we would be asked, can I get both at the same time? One on each arm, absolutely fine. Because we know if you get one and you'll say, I'll come back in a week or two for the second one, then life happens, things get in the way. It might be a week or two, it might be 3 or 4 weeks, it might be February. And we know the best prevention is actually the vaccines. Around flu vaccination, anyone that needs to see a GP or consultant once or twice a year for a long-term condition, they would be considered as having an at-risk condition. So if you need to have regular health checkups, then that's a long-term condition. Then you would be in the at-risk group for having the flu vaccine done. And I would suggest we get it done as early as possible. Carers and family members of stroke survivors should also have the flu vaccine, not just to protect themselves from catching flu, but also protect the ones that they care and live with. And it's really important. And we know that carers very often put themselves last because they're so busy caring for those that they're looking after. So it's important that you put yourself first and you avail of the flu vaccine as well. It can take up to 2 weeks for flu vaccine to be actually really fully effective. So it's important to be trying to encourage anyone with a significant risk to be vaccinated as early as possible in the season. So we've been really busy just making appointments, getting people in for the flu vaccine and then trying to do the COVID booster at the same time. Questions around flu vaccine that people will ask. What if I'm allergic to any component? Then we won't go with it. Tends to be egg white allergy because the flu vaccine is suspended and we go through if there's a history of egg allergy. It's particularly rare. And then people will also often say, I don't want to get the flu vaccine. It gives me the flu, or I know that someone got an awful dose last year and they got the flu vaccine. And because it takes 2 weeks for it to be fully effective, what's more than likely has happened is that you've become in contact with another circulating virus, particularly as we go on into the winter season, that actually you've just developed another cold that is not actually flu. With the flu vaccine, you will experience some side effects. You may have a sore arm, you may have um, pain on the injection site. You may have, because your body's really working hard to make antibodies to fight flu when you come in contact with it, you may have the symptoms of shivering, a little bit of a fever, aches and pains all over, but they tend to last just for 24 to 48 hours. They pass and your body is really working hard to make sure you're fully protected. Flu vaccines are very effective and they change every year depending on what the WHO, the World Health Organization, predicts as the most likely circulating viruses. So we've predicted four for this year, and they're the four virus strains that are in the vaccine. So just from your own point of view, both for stroke survivors and for anyone looking after those patients, it's really important that you avail of the flu vaccine, COVID booster where necessary or where appropriate, and do it as early in the season as you can. We tend to be really busy. There's really usually a high uptake of flu vaccine around now, October, early November, the first 6 weeks. Then people get a little bit complacent. We're getting the rush up to Christmas. People are busy. Life is happening. And that's when we begin to see the cases of flu and respiratory illnesses beginning to circulate and increase. And usually then around third week in December into Christmas and New Year, lots of people have been huddling together, lots of meetups. Then we see a spike and we see then flu vaccine increase again around early January. But we'd love to see those people vaccinated earlier in the season and we could see the number of cases reduced around the Christmas season, which would be great. And then additional services. Your pharmacist is there to discuss any health aspect. And whatever you think that I couldn't talk to her about that or I couldn't talk to him about that, we have heard almost everything. And we can signpost you if we can't help you or deal with something there and then or give you advice around what to do. We know where to signpost it to. So whether it's to physio services, whether it's to speech and language therapists, whether it's back to clinical care setting and in secondary care, wherever we need to go or wherever we need to perhaps go for some lifestyle or from uh, like living aids and some mobility aids, we can signpost wherever we need to. So what I'm really saying is your pharmacist is a wealth of information and use them. Don't sit at home wondering about something. Pick up the phone and ring them. In terms of the patient, the stroke survivor, what we try to make sure that everyone understands is how a medicine works. And we don't get into really detailed pharmacology with patients, but it's really important if someone especially is coming out, maybe having never had very many medicines before, and suddenly has to start taking 6 or 7 or 8 or 9 medicines, it's important that you know what each one is for. That you know that actually that one's going to help my blood pressure. This one will reduce my cholesterol. This one is for coagulation. And it's important that you know each one because it gives you that ownership and education. And the more we understand about conditions that we're experiencing, the more likely that we're going to be able to engage with the treatments. We reinforce how it's to be taken. Don't at any point think, I don't understand that. I'm not really sure. Because one of the most common labels that we put on a medicine, and many of you will see it when you have an antibiotic, it says 1 3 times a day. And I'll never just say to someone, just take that 1 3 times a day. Because when you leave the pharmacy, you might think, what did she mean by 3 times a day? Did she mean breakfast, lunch, and dinner? Did she mean after breakfast, before breakfast, with food or after food? Did you mean every 8 hours? Do I spread it over 24 hours? I'm not really sure. So it's really important that we help you understand how and when the medicine is taken. And also, if there is any difficulties with swallowing or dysphagia, which can be quite common, particularly in those early weeks following a stroke, perhaps some of those medicines aren't going to be suitable. Perhaps the medicine itself, the active ingredient is suitable, but for the formulation that we're about to dispense it in, maybe it's not suitable. Maybe you need a tablet that is particularly got a film coated, that it's got a softer coat on it that could swallow easier. Or maybe it's something that could be broken in half or crushed. And not all tablets are suitable for that. So we would talk through what ones are suitable to be broken and crushed and which ones absolutely cannot. And I'll explain the reasons why for now in a minute. Many medicines come in liquid form, but not all do. Some of them might come in sachet form that we can dissolve, or some might come in what's called an oral dispersible, so it might actually dissolve in the tongue. They're not all dispensed because the HSE, and rightly so, have to look after the drugs budget. We must dispense the most cost-effective medicine initially, but if there's a reason why that's not suitable, then we can go to another formulation, whether it's a liquid, whether it's a particular film coat, whether it's an oral dispersible. So we talk to the patient, say, actually, what's going on? How can we make sure that that medicine can be taken in the best way possible? And if you find when you get home and you're not able to take a medicine, or the person you're caring for isn't able to take a medicine, or it's causing difficulty, it's getting stuck in the throat, or the taste, or something's going on, come back to us. Because sometimes something simple as a brand change, so the actual company that makes the medicine, something simple can change and that can make the world of difference. So don't feel you can't ask that question. We very often go out with patients and like popping them into that and say, let's have a feel of this tablet. Let's see, is that going to be easy to slide down the throat? Is that going to be okay to go? Or is that a little bit too rough? Is that gritty or chalky? Is that going to cause maybe a tickle and cause a cough? Or is it, so we just have to make sure what's going to be helpful. We also go through what medicines are safe with your treatment, and anything that's taken can interact, as I said earlier. So prescription only medicines, over-the-counter medicines, herbal homeopathic products, they're not all safe. Quite a lot of them have quite a lot of interactions. So ones that you might remember, you might be aware of, you might have heard of, perhaps St. John's wort. I know it's a prescription only product now in the Republic of Ireland, but it's not in the UK. And that has quite a lot of interactions, particularly with cardiovascular medicine, so heart medicine, so with digoxin, with anticoagulants, can really impact those. And so before you take anything, check with your pharmacist if it's safe. An awful lot of the cough and cold preparations are absolutely contraindicated, so not allowed at all in any patient that has a risk or history of high blood pressure or heart disease. So it's really important that those kind of things are checked. And both pharmacists, our technicians, and our over-the-counter staff, our counter assistants, are trained to a certain to diploma level, to certain standards, that they know what to ask and what is safe and what isn't safe. So it's really important, even if you didn't get it in that pharmacy, to say, "Oh, actually, just remembered, I found this in the cupboard last night. Is that safe to take?" Pick up the phone and ask it before you take it. Really important. Um, Drug schemes we've covered off a little bit. Very often patients will, or family members will come in, particularly after that first hospital discharge, and not really sure where to start. And if the hospital has had a social worker, maybe gone around and maybe applied for the medical card for a patient, that's great. Doesn't always happen. So, or if someone has difficulty filling in their medical card application, I've often done that for patients. I've arranged to meet them maybe after the pharmacy it closes, or maybe see them in their home, and we can go through the medical card application for them. Whatever we can do to make things easier for patients is most important. We liaise with all healthcare workers. And since the pandemic, the actual paper-based prescription isn't as common as it used to be. You used to go to your GP and they'd write your prescription, usually illegibly, and people like me can read it, but most others couldn't. But they'll write the prescription and hand you the piece of paper and you bring it to the pharmacy. But now we use a thing called Health Mail, which is actually encrypted. So it's a secure email service that goes between GPs and pharmacists. And we can also then contact consultants with it as well and into hospitals. And it's been really useful because I could make maybe 40 or 50 phone calls to a GP practice in any one day, but actually can email really quickly and the receptionist might be able to help me with a query, or the GP can see it in between patients before we can get to phone them back. So it's been really, really useful. So we're that key link in between all of your healthcare providers. And as I said, try and use the same pharmacy whenever you can, because we're the one that links up between everyone. We do provide compliance on mobility aids. When you go into a pharmacy, because our premises, most of our pharmacies are in smaller buildings. Well, a lot of them, like my own, used to be a house. So kind of my structure, the actual physical structure of the pharmacy is trying to be modified from what it was previously. So we don't always have a lot of space. But in storage or that we can access really, really promptly, we can get compliance aids and mobility aids. And we would often order those and have them in within 24, 48 hours for patients. We have a really good ordering system in pharmacies and we can have things delivered very, very promptly. So things around initially compliance aids. So the first one that we would offer to patients is perhaps a little tray that you can put your tablets into. We know that memory and thinking and cognitive function can be impacted depending on the severity of a stroke. So perhaps we can help you remember how and when to take the tablets. So we can supply a little tray that people or someone, a carer, can pop tablets in. So you'll know it usually has 4 compartments, so morning, lunchtime, evening, bedtime, and we can pop those in. Not everything is suitable to go into those trays, and we would explain to patients what is and what isn't. If that's a difficulty, some pharmacists can supply what's called blister packing, so have your medicines prepared in the pharmacy in sealed trays, usually with a sheet then with a picture of each tablet the name of each tablet and when you take it. And that's really effective. So you can go along. And oftentimes family members will come in and they'll bring the trays back maybe halfway through the week. And I might see usually and maybe the noon dose, the middle dose is being missed. And we think, okay, well, what's going on there? Why are we missing that dose? Where can I make that easier for the patient? Maybe it's a chalky tablet, it's getting stuck in the throat. Maybe it's calcium that most people don't want to take. Or maybe noon is a time when someone's dozing or they're having a nap and they forget that one every time, maybe waking up at 2 or 3. So let's change the timing of the tablet. So even the compliance aids, it's not a matter of giving that and see how you get on. Always come back and talk through with the pharmacist. And then other mobility aids around maybe cups, things that can help you open jars, maybe some other things, just any of those. We have catalogs within the pharmacy that we can go, actually, can I order walking frames for you if you can't source them elsewhere? Can I order things like the jar assistance or cups or anything that can be done there? All we go through them with patients and say, what do you need? What can we get for you? And then in terms of home delivery, if a patient is housebound or has significant mobility issues and isn't able to come out of the pharmacy just or out of their home as easily, we will deliver medicines. Most pharmacies deliver medicines to your home, either during the day or when the pharmacy closes. We would have a policy that when we're doing a home delivery, we would always want a pharmacist to do it 99% of the time. So I'll either do them after the pharmacy closes if I'm the only pharmacist on that day, or we would usually have two pharmacists on, so we bring the medicine to the patient's home. And that means that there's another opportunity to ask questions should you need to. And you'd be surprised at the questions we could ask when I go to someone's home. I'll say, show me how you're getting on. And they'll show me their tablets. And I'll say, oh, right. How come we've got more cholesterol tablets than blood pressure tablets? What's happening there? Oh, I take those ones at night time and I'm usually asleep and sometimes I forget. Okay, so what can we do? How can we make that easier for you? So those home deliveries can be really important because it gives you an extra opportunity to interact with your pharmacist and ask questions. Things that you need to know about your medicines. And it's important that people do know these questions about the medicines. I'm going to talk through this campaign called No, Check, Ask. It's really important. The more ownership you have over your condition and your medicine, the more likely you are to understand it and the more likely you are to identify problems if they happen, or even engage and empower yourself to take the medicine as prescribed. So I have a chart to show you the things I encourage people to carry with them. What's your medicine called? It's remarkable the amount of people that I don't expect you to know the full long chemical name, but if you even know that's my blood pressure one, that's my aspirin, that's my um I don't know, my Lipitor, my Crestor, my atorvastatin. If you just know what your medicine's called and what's it for. That's my atorvastatin. I know it's for my cholesterol. Those two as well. Because on that, oftentimes you may be prescribed an antibiotic and the prescriber will say, don't take your cholesterol one with that antibiotic. And you'll get home, you'll go, I don't know which one's which. So it's important that there is a certain level of knowledge there. How do I take it? And how do we take it just doesn't mean do I swallow it? Maybe it's a spray formulation, maybe it's a gel, maybe it's a liquid. But how do I take it also means is it morning, is it evening, is it middle of the day, how many times in the day, is it before or after food? A lot of those things are on the labels. But as we age, the labels can be really hard to read. The labels have a lot of information on them. There's a lot of information on labels that we're legally obliged to put on, but not everything we want to be able to put on. Space labels are small. So how should I take it? And then what do I do if I miss a dose? So say we did fall asleep and we forgot to take the middle of the day medicine or fell asleep for a few nights early and forgot to take the cholesterol tablet. Or the most common one is people have said, I forgot. I just got up. I got up out my day. I was feeling really good. And now it's lunchtime and I've forgotten to take my blood pressure tablet. What do I do? Or if you forget an entire day of tablets, what's happened? You know? So what do I do if I miss a dose? Do I take the next dose? Do I skip that dose? Do I take two doses together? It's really important. And that is all medicine specific. So regardless of what happens, contact the pharmacy. And we would talk around then. If it's a regular occurrence, what do we do to help address that? Are there any activities, foods, or other medications I should avoid while taking this medicine? And with that, there's one, and a lot of women, maybe over the age of 60, 65, 70, might take something to help their bones strengthen up. So might take it once a week. And it's really important with that one, we would give advice that you take it. We remain upright for 2 hours afterwards. We can't take food. Um, and I would even say to people, when I tell someone to stay upright after taking a medicine, that also means not bending over to the dishwasher, not hunching into the washing machine, but actually upright means upright. So go for a walk, or you can just sit down, watch television, but that the esophagus, the food pipe is still upright. So there are things like that that are really important that for particular medicines. We know that when a pharmacist is speaking to you, particularly after a GP consultation or hospital consultation, there's only so much we can take in. There's only so much any of us take in with any conversation. We might only take in the first 5 or 6 minutes. I think 30 seconds is our full attention span, and then the head begins to switch off a little. So we try and encourage people to repeat back to us. So this is your cholesterol tablet. Do you remember what this one is for? Oh yeah, that's cholesterol. And that will help reinforce that medicine or that information within you. So the pharmacist is really skilled at trying to do that with you. And then we talk about side effects, what to do if side effects occur. Some side effects are okay and they just are bothersome in terms of maybe a bit of constipation. So we'll talk around what to do with that. But other side effects might be quite significant, might be a red flag for us, and you might need immediate assistance. So we talk through which ones we can live with, which ones we can manage ourselves, and which ones need to see a doctor or hospital straight away. So really with that, what do you need to know? You need to know your dosage. You need to know what can help you adhere or comply with the treatment. And I suppose the most expensive medicine is the one that's not taken at all. Because if we end up with a secondary event and we're back into hospital and we're back into for quality of life and all of that, there's expense on the patient in terms of their health, their expense in the health system in terms of hospital care, really expensive. So let's try and get medication treatment and treatment adherence. So you're taking what's prescribed and you're getting the best benefit out of it. And administration of medicine, so whether it's a liquid form, tablet form, how can we get you to help to get the best medicine? How can you it be more palatable for you? And management of risk factors. So your diet, your physical activity, smoking and alcohol. And as the evidence shows that when a pharmacist gives you advice around your diet, your physical activity, and your smoking status and alcohol, that will reinforce what you've heard from other healthcare practitioners. It will reinforce, and you're hearing it a little bit more frequently. You're hearing it from us too. And where there's the support structure, you might come in and go, "Do you know, I was doing really well. I gave up cigarettes. I did really well for 4 or 5 weeks. I've fallen back on them. What do I do? Right, let's pick ourselves up again. Let's start again." Pharmacist is there to help you do that. I am hearing for patients that don't have a medical card, and just actually that you are aware that nicotine replacement products are available on the medical card system, but they're not on the drug payment system. But we are hoping that that changes in the new year. I'm conscious of time, so I just want to talk to you about the No Check Ask campaign, which is just what I've said around knowing what your medicine is about. So these leaflets and booklets are available in your pharmacy. So I'd encourage anyone to go in. It doesn't have to be that particular leaflet. Your pharmacy can do a printout, someone can walk, do it for you. So know your medicines and keep a list. I actually encourage all patients on any long-term medicines to keep a list of medicines in their fridge, because when a paramedic comes to your house, if they're needed, most houses have a fridge, and most paramedics know if there's a medicines list on the fridge or in the fridge, and we have these little blue boxes we put in the fridge, that's where we get an up-to-date list. They need something quickly. Check that the medicine that you're using is the right medicine and you're using it in the right way. And ask your health professional, your pharmacist, if you're unsure. So even just no check, ask. That's what we're there for. There's a leaflet there. We all of these lists in the pharmacy. A really important list to have that have your emergency contact details. They'll have your doctor's name, your pharmacist's name, phone numbers, and then lists of medicines. It's difficult to write them down, so it's no problem to ask your pharmacist to print them out. And we know when you're going in for a follow-up appointment, you'll always be asked to bring a list of your medicines with you. We will print those daily for people. They ask us all the time. By bringing and having a list of your medicines, it can reduce the chance of errors. It's remarkable the amount of people that maybe are gone in an ambulance and paramedics have no idea what someone's on. They just know I'm on 4 or 5 little white tablets. I might take a blue one at night time. And that's not a whole lot of information for people. So do try and keep a list of all medicines, including over-the-counter and non-prescription medicines, any allergies and that. Some people have photographs on them on the phone, and then it'd be really useful to share that list with a family member or a carer. Any changes, the pharmacist, doctor, and nurse specialist can help explain those to you. This is just around what happens when you're starting your medicine, starting your medicine, taking it in, and when medicines are reviewed. And we have a discipline called polypharmacy, and we know that many people over the age of 55 take 5 or more medicines. And when we take 5 or more medicines, we're at a significantly increased risk of falls. And falls for stroke patients are also a higher risk. And fall can be a really significant health event, and you can break a bone catastrophically and have possibly a very poor outcome from it. So it's important that we talk around polypharmacy and deep prescribing, and pharmacists would be very key when we talk through with medicines with patients. You might find that your lung doctor puts you on one medicine, the heart doctor might put you on something else, the tummy doctor might put you on something else. Suddenly then there's 6 or 7 or 8 or 9 medicines, and we need to make sure are they all necessary. And it drives pharmacists mad when medicines are being prescribed, but maybe they're not needed anymore. So we try and de-prescribe or encourage even doctors, the jet family practice, to de-prescribe and kind of not leave people just on something long term because it was started 6 or 7 or 8 years ago. So if you're worried about a fall, talk to the pharmacist. If you're feeling lightheaded or having episodes of fear or worry about a fall, talk to the pharmacist. Could be one of your medicines that's causing side effects. So we'll have a look at that. And then taking long-term medicine, it's really important it's reviewed at least once a year, particularly if you're taking 4 or more types of medicines a day. Anything more than 5, and you're at a significant increased risk of falls. Discussing any medicines issue with your pharmacist, and then asking us to order any mobility aids for you if we don't have them in stock. Helen, I'm very conscious of the time, and I know it's 5 to 12.
Well,
So
I'm going to stop recording now, Kathy.